Hi, it's Debbie Shatzkes from Lenox Hill Hospital in New York City. And in this lecture, I'm going to highlight 10 diagnoses in the head and neck that I think are ones that are easy to miss, are commonly missed, and certainly ones that I have missed myself. So we're going to start with number 10, and that is cystic lymphadenopathy that is called branchial cleft cyst. So we know that cystic lymph nodes are very common with oropharyngeal primaries, particularly those that are HPV related. And oropharyngeal primaries frequently metastasize to level 2. And level 2, the upper portion of the internal jugular chain in the neck, is really exactly the same location where we find second branchial cleft cysts, which are common congenital lesions. One thing we do want to remember is that the diagnosis of a branchial cleft cyst should really be made with extreme caution in adult patients. Again, these are congenital lesions, and while on occasion they may present in adulthood, typically they should present when people are younger. So this is the classic appearance of a second branchial cleft cyst. These are typically thin-walled, smooth, cystic masses. The contents will usually be uniformly hypodense, although with infection, the contents may become a little bit more dense and the walls may be a little bit thicker, but they occur in this very characteristic location. So they occur along the anterior margin of the sternocleidomastoid muscle, and as you can see on the image on the left, there's often flattening of that anterior margin. They lie behind the submandibular gland and lateral to the structures of the carotid sheath. Now, that actually is in a really good location for a level 2 lymph node. All right, well, let's look at some cases, and these were all called branchial cleft cysts and were not. So here we've got a mass. It's a round, pretty regular walled looking mass in right level 2. So we can see it's in kind of that triangle. It's behind the submandibular gland, lateral to the carotid sheath, and pretty much along the anterior margin of the sternocleidomastoid muscles. So we do notice that the density is not really very cystic in appearance, but the wall actually does look fairly well marginated. There's some sort of weird septation in it that we can see on the coronal and sagittal images. And, granted, I think this could be a difficult call, but there's more information on this film. And if we look carefully, there's a mass at the base of tongue, so an oropharyngeal primary tumor. And this, in fact, was a case of metastatic HPV positive base of tongue squamous cell carcinoma.